Hello, everyone. I'm Dr. Renee Mehrra, and welcome to our viewers on TV Asia and social media. Today, we're going to talk about oral health as it intersects with COVID-19. Why is it so important? It's always important to have good oral health, but why is it so important, especially in these times when you can't see the doctor so many times? It's more of a telehealth visit. So I'm talking to Dr. Hemali Ajmera, and she's a general and cosmetic dentist in Queens, New York, and she is very engaged in the American Dental Society on local and state and federal level. And it's always a pleasure to talk to her. It's a family dentistry. It's a whole family, Molly, that your family works together, your father, your mother, and yourself. And I wanted to ask you, especially during this global pandemic, why is oral health so important, and does it have an impact on our immune system?
So Renee, it's so lovely to be here with you from the comfort of our home. And, it is an interesting time to be a dentist because I find myself advising my patients and, doing that as more of a teledentistry than in-person thing. And so it's good to be able to connect with everyone this way. Or general and overall health is important, but oral health continues to stay very important and in the forefront, especially because we know that the route of transmission for COVID-19 is really through the oral cavity and the nose, as well as by touch, which makes it very unique in comparison to most of the viral bacteria and fungal infections we know about these days. So it continues to be important for patients to brush 2-3 times a day if possible, continue flossing, using their oral irrigation in whatever manner that they're using it. As you know, in the past, we've discussed things like the Water Pick and the Sonicare Floss Pro for those who need a little bit of help in that arena. But yes, it's of utmost importance that even though dentists are only available for emergencies, that these elective activities continue to stay on the forefront in the home, more so than ever before.
So now that, as you mentioned, it's more like telehealth visits, and that's going to be more kind of accelerating more. But and there are less of the elective dental surgeries. So how do you observe them? Do you go to the telehealth? Patient comes to you through the telehealth, and then let them know how to clean between the teeth. You mentioned that, but share some more ways of working it out. Sometimes somebody can have a tooth pain, and they can come to you this time. What would you suggest? What would be your recommendations?
My recommendations are that there's going to be different levels of discomfort and there's different levels of needs for every single patient. So anything that can be postponed and put off, using things like, a chlorhexidine mouthwash or hydrogen peroxide where it's possible, to keep things under control. For sensitivity, there's a lot of toothpaste on the market. Sensodyne happens to be on the forefront and one of the more well-known brands. There's different things such as Kenalog and Orabase. Many patients who suffer from aphthous ulcers can take, specific medications based on other types of jaw discomfort that they have. Then the next level up is any kind of inflammation that you might have, things that could stem from a deep cavity, things that can stem from neglected wisdom tooth removal, thinking, oh, I'll go anytime and get that taken care of. So of course there's medications that you should only take at the advice of your dentist, but surgeon offices and hospital centers have remained open for those type of essential urgent emergencies. And then of course, those who suffer from any type of cancer or lesions that can go into the airway, the sinus, or the back of the head that can be a little more deadly. Those are very urgent care needs, and those are the kind of needs that are worth venturing out for, because you have to remember that when you leave the house, any public transportation you might take, any hospital you might enter, could be an area that could be risky for you to be in, versus staying at home and just sitting it out for a couple of weeks or months before things get back up and running. On our end as dentists, of course, we do everything we can with the PPE that we have on hand to protect our patients once they do make their way over to us.
Now, yes, of course, it's something very urgent. It requires immediate attention, and then the patient has to come to you. But I think probably if you schedule a telehealth visit, and then you can check what needs to be done, and that they can come over, because if it requires immediate attention and immediate procedure, then it's important that they come to you right away. Talking about family as a whole, because we have a lot of social distancing, but not everybody is at home. Good, healthy nutrition is very, very important, even more so now than it was before. But it's very important that the whole family stays healthy. And I go back to the same question that I asked you before about having a strong immune system, so that we are able to resist any sort of bacterial or any infection. Because if you have a weak system, the system is compromised, or somebody has a pre-existing medical condition, things can get a little out of control. So what would you recommend for the whole family implementing good, healthy habits and healthy nutritional lifestyle?
So immunity has a lot of different various dynamics that go along with it. So, the mother and the child are generally very closely immunologically related to each other. And so those with stronger immunity at these times, of course, fare a little bit better. And, for them, per the advice of their general physician, vitamins, healthier foods and snacks, as we all know, fruits, vegetables, your proteins in whatever form you can take them are like very important. Fiber in your diet continues to remain really important. And, in terms of immunity boosters, keeping your children up on their vaccines at these times. I know it's a little tough to get to a doctor, but it's important to make sure that they get their vaccination if you have young children at home. Now, immunologically, your body is going to fight the viral load very differently person to person, even if you're in the same family, which is why it's important that if you're isolating or quarantining, those that you are with are also maintaining and following these social distancing guidelines. There's nothing that says, that children won't get it, adolescents won't get it, or, no one is really exempt. And at this time, it's really also important to remember that pregnant women are also considered immunocompromised and have to be very careful. And that's something, we don't want anyone to find out the hard way. So that's an important message as things get back up and running in various phases. In terms of immunology with the virus itself, that gets a little bit more in depth as we talk about different ways of testing for the virus. As we know, salivary testing has come to the forefront, and the viral load of the bacteria can be found in the mouth, and it does settle down there, and we don't know how long it can stay there. The oral microbiota is a very delicate balance, and we know that there are various strains of bacteria and fungus in the mouth that are native to the mouth, and as long as you keep that aspect of your body healthy and well maintained, it doesn't leave any weak or sore spots for the virus to settle in. Long-term immunity is person to person. So you want to make sure that if you're diabetic, if you have cholesterol issues, any other type of pre-existing factors that can predispose you to becoming, more apt to getting this virus, you're staying on top of your medications and you're making sure you're taking care of yourself. Exercise, sunlight, You know, stress is another factor that becomes very important because you can start clenching and grinding your teeth at these times. Many families have financial issues that they're coming across. So, you know, call your dentist, send them any photos or videos of your teeth if you feel like you're clenching or grinding a little too much, because that can cause your teeth to fracture and it can cause migraines. So just remember to stay calm, get a good night of sleep. You know, don't work late at night, don't watch too much TV, because I know everyone's home, so it's really easy to, you know, let things get out of control. But as a family, you should work together to, you know, maintain the same health guidelines, healthy diet, maintain a good healthy lifestyle, and set boundaries where they need to be, since you don't have that routine 9 to 5 work or school structure in place.
That's right. Well, into normal. That's what happens. So, as Dr. Ajmera mentioned, you know, healthy lifestyle always should be there all the time, but more so in these challenging times, so that your immune system is strong and able to resist any sort of infection. And again, please maintain social distancing, wear the mask, and always wash your hands at least 20 seconds. That's really important. So great tips, Hemali Ajmera, for our viewers, and they should be able to handle this, you know, with calm and equipoise. That's so very important, because stress can only make things even worse, not just for our teeth, for our whole body. So it's important that we keep our mental, emotional, psychological state healthy, and stay calm, stay positive, and stay healthy. Thank you very much, Hemali Ajmera, general and cosmetic dentist working in Queens, New York, and very, very actively engaged with the American Dental Society on city, state, and federal level. And thank you so very much for your insightful tips.
Thank you, Renee.
And I'm Dr. Renee Mehrra. Thank you so much for watching TV Asia and our social media. Thank you.